morning, everyone, and welcome to today's PHO webinar presentation on a new environmental cleaning resources launch. My name is Nawal Toba. I'm a regional IPAC specialist at Public Health Ontario, and I have the pleasure to moderate today's session. Before we start, I just would like to mention a few items, housekeeping items. First one is to enhance the presentation experience, participant audio and video has been disabled. The chat pod has been disabled to limit any distraction during the presentation. Please use the Q&A pod if you have questions during the session. A discussion and a questions period will be followed at the presentation. If you have at any point during the session, if you experience any technical issues, please email capacitybuilding@oahpp.ca. It's now my pleasure to introduce my speakers for today's presentation, Eva Skype and Tanya Danish. Eva joined PHO and is infection control consultant in 2009. She has a degree in nursing and also holds a urology nursing certificate and certification in infection control CIC designation. Eva is a member of IPAC Canada and was presented on IPAC Canada GTA chapter. She was the president. Eva begins a career of in long-term care in 1990, where she acquired extensive experience of both infection control and director of care roles. Eva also worked in IPAC acute care at Credit Valley Hospital in 2009. Prior to Point PHO, Eva has presented at national conference and provincial and local events. My second presenter is Tanya Danish, is an IPAC specialist with health protection at PHO. Tanya has been an infection control practitioner since 2007 and was the IPAC team in various acute care, including the emergency department, operating room, and medical device reprocessing, maternal child, complex care, and critical care unit. Tanya holds a Bachelor of Science from University of Waterloo, a master's degree in microbiology from the University of Guelph, and certification in infection control epidemiology. I would now pass to Eva to start the presentation. Thank you. To you, Eva.
Good morning, everyone. Thank you so much, Nawal. It's a great pleasure to be a part of this project. Environmental cleaning is close to heart, and it's also a very important component of the IPAC program in your facilities. So today we will go over a little history of environmental cleaning at PHO, the new infection prevention control for environmental cleaning in healthcare online learning modules, as well as overview of additional resources to support environmental service workers and managers. So before we begin, just a little bit of background regarding Public Health Ontario. So Public Health Ontario is a provincial government agency with a mandate to provide scientific and technical advice and support to those working in government, public health, healthcare, and other related sectors. So IPAC at PHO provides healthcare professionals with expertise, support, and resources for IPAC. So our project involved combining evidence from the literature with that of our partner consultations, which allowed us to determine some specific resources we wanted to develop, such as printable visual cards, resources to support huddle conversations, audit tools, as well as some online modules that could continue to be used for orientation and training. Consultations indicated there was a need for, first of all, accessibility to best practice information, also tools to support managerial wants and needs, the need for different approaches to target learning styles and stakeholder gaps, and new approaches to capture audience attention. There was also a system need for products to support implementation of PHO information within settings, some free resources for environmental service workers and leaders, and also improved access to information that is useful. So the work of environmental service leaders and also staff is vital to IPAC and critical for everyone's safety. So the amazing work you all do to help mitigate risk does not go unnoticed. And on this slide, you can see a snap from the front page of the PHO best practices for environmental cleaning for prevention and control of infections in all healthcare setting, 2018. And the content was based on this PHO document. Excuse me. So, welcome to the course, the Infection Prevention and Control for Environmental Cleaning in Healthcare, the online learning modules. So, I would strongly encourage you to visit our website, especially those of you who are not familiar or are not using our PHO resources. And once you visit the website, you might want to create a My PHO account, and this will then allow you to access the online learning modules, print certificates of completion, and save some of great resources to your page for any future references. So the online learning modules that are available through PHO's learning management systems, those can be added to your own learning management system called LMS. And that way you can access, view, print, or download a certificate of completion in LMS. Modules contain links to relevant companion resources. And also those modules are highly interactive, modern, visually compelling with some intuitive navigation. And we will now discuss more features of the course before we move to the actual course content. So the course was designed in an e-learning software, which is quite different from the traditional PowerPoint slide deck that we use, and should feel familiar to scroll through an online magazine or website. And the modules will run in any browser window, and the modules can be accessed using different devices, including desktop computers, laptop computers, tablets, as well as mobile phones. The software will adapt to the size of the screen being utilized, and also the modules are AODA compliant and accessible using a mouse, keyboard, or touch screen, and are also compatible with all popular screen readers. So here are some interactive features. So the first one is knowledge checks, and those are included in each module to help you reinforce the information that was presented. The knowledge checks are not graded, so you don't have to worry about wrong or right answers, and the correct answer is provided to the learner. The next one is flip cards, and you can click on them for additional learning. A picture or key term is made available on one side and more information on the other. And the third one is external media, and that includes visiting a website or viewing a video outside of the module, which you can do by clicking and opening in a new window. It's important to remember that if the learner exits or leaves the screen unattended for an extended time, they may lose tracked progress and will then need to restart the module from the beginning. But no worries, because the modules are only 10 to 15 minutes long. So finally, we can go through the actual modules. So in addition to the course overview module, there are 6 learning modules that make up this course. So module 1 to 5 in the course are recommended for those who work in the environmental services in healthcare settings. And then the last module, module 6, is recommended for leaders of the environmental services in healthcare settings. But those who are wishing to take module 6 must first complete module 1 to 5. And as I mentioned earlier, each module should take approximately 10 to 15 minutes to complete. And modules must be completed in the order in which they are listed above. And those who complete the first 5 modules will be provided with a certificate of completion. And those who complete the 6th module will be provided with a separate and distinct certificate of completion. So the first step is to review the course overview, and that is meant to help you understand the layout of the course and the modules that are included in it. So this module will also show you how to navigate the course as you work through its different interactive components. So module 1, this module is designed to introduce you to the environmental cleaning and infection prevention and control, or IPAC for short, in healthcare. Module 2 is designed to introduce you to how infections spread using the chain of transmission model and how we can stop them from spreading. Module 3 is designed to introduce you to the general principles of routine practices and additional precautions in environmental cleaning. And that entails, of course, routine practices, additional precautions, as well as administrative and environmental controls, risk assessment, hand hygiene, as well as personal protective equipment. Module 4 is designed to introduce you to best practices, techniques, as well as tools that should be applied to a range of environmental cleaning procedures in healthcare. And Module 5 is designed to introduce you to workflow principles to a variety of cleaning procedures in order to reduce the spread of infections in the environment. And that also includes components on cleaning surfaces, handling waste, as well as sharps and laundry. And the last module, module 6, as I mentioned earlier, is designed to introduce leaders of environmental services in healthcare to various aspects of their role that contribute to preventing and controlling the spread of infections. That includes selecting the products, tools, and equipment, as well as managing the frequency of cleaning and assessing the quality of cleaning and cleanliness using different types of audits. And as mentioned before, the Module 6 can also be viewed by frontline staff as well. And I would like to welcome Tanya to continue with the presentation. Thank you.
So much, Ava, for that. Happy to be here with everyone today and introduce our new environmental cleaning resources. I'm just pulling up the screenshot of the web page here where you'll find all these new EC resources we're talking about. This replaces the former environmental cleaning toolkit that was up there. So, and Ava went through the modules, and we're going to talk about a whole suite of other resources that are designed to support environmental service workers and managers. So here's just that. And we're going to do a live demo of the website as well, so you can see where everything's housed and just make it a little easier to access when you need to find them. So the whole suite of resources, it's a multi-product strategy to exist the existing barriers. These products include a huddle resource, infographics, frequently asked questions about significant organisms in environmental cleaning, as well as environmental cleaning audits. And that includes the introduction to implementing environmental cleaning audits, as well as performance observation audit, environmental audit, marking audit, and visual assessment audit, and their accompanying implementation guides. So we'll talk about those a little more. So for those who are already using the Huddle as a communication tool, this resource can be used to augment their process, or perhaps use it in staff meetings if you aren't using, don't have a resource for that. So it could be a great key for those who aren't doing staff huddles. Might be good to flip through this to see some ideas that you can garner. This resource is designed for leaders in environmental service and healthcare settings, and just provides reminders of key information at huddles or meetings to environmental service workers, and especially for new employees. It also can provide a rapid refresh for updates to EVS workers, and the huddle is intended to provide that rapid overview really quickly, just to provide a staff briefing of a success or an area for improvement, selecting, and it works when we go through the manual. I'll show you by specific topic, and then shows you a process and a demo, so that you can help to improve that process or just celebrate your successes, whatever the case may be. So for those of you that are already accustomed to using it, you could cross-reference these infographic tools with the checklists you already have and just see, the elements you'd like to include, or perhaps you might like these new tools, and I'll show you how they're laid out a little later on. And for those that aren't, we'll take you through that as well, so that you can maybe incorporate this into your practice. There are 3 infographics: routine room cleaning, routine bathroom cleaning, and routine discharge transfer cleaning. Each shows the order of cleaning tasks before, during, and after cleaning. And these are also designed to be useful during orientation, as for refreshers or on the spot training. And they can be printed and laminated to keep on housekeeping carts, so they can be used as a point of cleaning to refer to, or posted outside of rooms if you wish. Now, just moving on to the frequently asked questions regarding significant organisms and environmental cleaning. So you can see the different organisms in this FAQ. This document gives answers to questions that environmental services leaders often hear about in healthcare environments. This document will help your EVS leaders to answer questions their staff may also have. This document includes information on how microorganisms are spread, how the spread can be controlled, and also including microorganism specific environmental cleaning considerations. So just a handy FAQ for all those questions that come up repeatedly, and could be a really good resource to use there. So the first document I'd like to introduce is the Introduction to Implementing Environmental Cleaning Audit. This introduction guide goes over how to implement an auditing program within a healthcare setting, and how to ensure that this process is collaborative. This guide provides guidance on performance observation, environmental marking, and visual assessment, going through the whole step as you implement your auditing program, or perhaps seek to review your auditing program. It provides those considerations for healthcare facilities to develop or improve the auditing portion, and it is, of course, based on PIDA recommendation, and is intended for environmental services managers, supervisors, peer leaders, or anyone completing audits. So there are 3 implementation guides. Along with the intro, there's 3 others that support the performance observation, environmental marking, and visual assessment audits. And they all follow the same 5-step plan you see at the bottom of your slide, and that follows plan, audit, analyze and strategize, implement strategies, and improve and sustain. So I'm just going to take you through next through our performance observation audit. So this tool can be used to observe a worker that is performing a routine clean of a patient resident room. Of course, it follows best practice. It is fillable, and I'll do a demo of that later on. And it goes hand in hand with the implementation guide that I mentioned. So it's kind of a how to implement this in your facility, in your home. And, the performance observation, as you know, involves trained observers, often environmental service supervisors, watching the EVS workers perform routine cleaning tasks, and then being assessed on what is being done against the checklist. And it just provides that opportunity to provide that direct feedback from supervisors to frontline staff, and then, of course, from frontline staff to supervisor, just really that 360 lens on environmental cleaning. And next, auditing tool is for environmental marking audit. For those unfamiliar, this is based on an invisible tracing agent that fluoresces under black light. So you would apply that marking, and then to surfaces before the room is clean, and then the auditor uses the black light to see if anything remains after the room has been cleaned. This tool has 6 surfaces that facilities could consider, and you can also customize it to add your own surfaces that you would like. And this performance audit, this tool can be used with the implementation guide to identify barriers and gaps, create an action plan, and implement strategies for overall quality improvement, and to share results, maintain and sustain improvements. And this spreadsheet, I do have a live demo that I've done up, so I'll show you that. But just to say that all the markings that come out of your auditing tool can be entered into this Excel spreadsheet, and it will compile your results automatically. And that, the strength of that is that day after day, week after week, month after month, you can see the changes you've sustained or any improvements that need to be made. And that really speaks volumes when you're able to present that to frontline staff and management, just to see, where your journey that you've come from in your facility, in your home, as far as environmental cleaning. So I will show you that later. The visual assessment audit is divided into the 4 sections listed there. Again, similar to the other audits, it does have an implementation implementation guide that can be used to identify barriers and gaps and create an action plan and to work towards strategies for overall quality improvement. And we know that visual assessment is the assessment of cleanliness that looks at whether dust or debris or soil is present. And what I like about this too is that this can be used for a variety, not just EVS workers. We know that keeping a clinic room clean or a patient room clean is not just a responsible of the EVS worker, but multiple people, multiple job classes. So it could be used kind of for that 360 view of EVS cleaning of different job disciplines, job classes, and can also look at general maintenance to determine if something like a mattress is damaged and needs replacing. So it can be used for different modalities in your setting. And again, this also comes with an Excel document, so you can aggregate your data. We'll aggregate it automatically once you enter it and provide it with some nice summary tables that you can use to present to staff or management, just to see what's going on a glance at your facility week after week, month after month, to see again your journey with your auditing, with your environmental cleaning over time. And I think that really just speaks to that strength of your program when you can just track those changes over time and look for ways to improve or ways to sustain your good work. So I'm just going to take you on a live demo of our website. So let me just switch screens here. Okay, so here is the main page of the PHO environmental cleaning webpage. That's the whole host of resources we've been talking about. So if you go to health topics, IPAC environmental cleaning, or you can do a quick Google search, environmental cleaning, Public Health Ontario, it will take you to the landing page here. I like to start at the best practice. That's where I'm going to start with you today. Here's the fundamentals that Ava talked about, your best practice for environmental cleaning for prevention and control of infections in all healthcare settings, really kind of the fundamentals for all these resources here that we're chatting about today. And this is the huddle resources we did talk about, and I will take you through that. So here is the huddle resource, and you can see that it's divided into different topics. So we'll pick glove use, and we'll just skip to that. So say you had some successes or some challenge with the glove use in your facility, in your home, with workers wearing gloves. You could talk about, why it's important that gloves are reworn, reminders on how to use correct technique and picking correct product, as well as some do's and don'ts, as well as the demonstration that you can see at the bottom, and some videos that you could show to staff on a huddle, or if you had a laptop you could take around, or perhaps using the unit computer, the nursing station computer, you could show it via that way. So going back to the website, then we can go to our fact sheets and infographics. So we can look at our implementation guide. So that's the introduction, the overall introduction to environmental cleaning auditing that we talked about. So it takes you, through the implementation of that at your facility. So just the thorough steps of all the different auditing and how you can implement that. As well, we do have our implementation guides for environmental marking audits, visual assessment audits, and then the other one was for implementing performance observation audits. So the 3 implementation guides can be found here. I will take you through the intro one so you can see how it's laid out. So it really takes you through all the background of environmental cleaning, hotel clean, and the differences of healthcare clean versus hotel clean, and the different types of visual assessment, performance observation, environmental marking, just take you through all that theory there. And if we go back, we can see these shorter guides that are really targeting to each audit, and they do follow that 5-step plan that we mentioned. And they take you through how you can use that auditing tool and really just the background information there. Now, if we go to checklists, these are where we can find the auditing tool. So these are the environmental marking auditing, and this is a fillable form. So you could type in today's date if you were taking this around today, fill in your time, your unit, and simply, if you had a tablet, or you could print it, and you could fill it out like so. And you can see that the different surfaces are there, and you could put your calculations and your date completing. So this is for your environmental marking auditing. If you've marked it previously with your fluorescent compound and taken and then cleaned and put it under a light, you could see the results that way. So, and we also have the accompanying Excel spreadsheets that we mentioned, and I've taken the liberty of entering that into creating a big data set. So this is your instructions on how to do that. And here I've created the data set. I pretended I've gone on a unit. I thought I would switch. So I've created this data set. It has this introduction to this workbook. We're talking about environmental cleaning marking audit, and this Excel spreadsheet can be found on the PHO website. Here's the data that we've entered for patient room, bathroom, or other surfaces. And I've entered it in as if we've done the auditing. And then you can see that it's done the aggregate score. It calculates that automatically. And we can see on this unit, oh, our bathroom surfaces look pretty good except for our handrails. And we have our mobile equipment. We have some issues there, but we are really good in our patient room, except for maybe our call bells, bedside tables, and bed rails need some work. So we can see that, this is a really good tool that we can quickly use to share data with frontline staff. Just at a moment in time or tracked over time, we can see how that will track our results. And I'm just going to switch back to our website. Should take just a few moments. So here are our 3 audits that we've talked about. I'll show you the other visual assessment one. So again, fillable, and you can tabulate with as a iPad or printer. And the Excel spreadsheets that I was speaking of can be found here. So you can download that. I won't open them up today because it opens up in Excel. I've showed you that, but you can download that and then customize it and save to your desktop or to your own computer, workplace computer. And then finally to the fact sheet or infographic. We do have our infographics, which I really like because I think they are a handy tool to use and are really nice graphically and have some data or some words for you to follow along with your checklist. So you could laminate these and put them on the housekeeping carts or outside the room, really provide that quick visual for retraining, for a refresh. And we have a couple of those. I will demo those as well. So that was the daily cleaning patient resident bathroom. This is the discharge transfer clean. Again, following the same format, as well as before and after cleaning of a patient resident room. So there's 3 of those. And then to the FAQ as well that we mentioned earlier in the presentation. So divided up into topics, you can see the topics there, and you can jump through that. And this provides your background. What is MRSA? How is it spread? How can we control it? What are the possible impacts of acquiring MRSA? What are environmental considerations for MRSA? So just really taking through all the frequently asked questions that you can occur in your facility. And so this really could be used as fact sheets, could be used in your huddles and meetings or your annual education if you have that, your unit education. So just really a lot of different approaches there. So just keep in mind the general categories of this website may shift around, things may move, but you can see that the tabs at the top will provide you with a link to find them, and you should be able to pull them up pretty easily, but I know through time there could be some reorganization. So I just wanted to show you just a live demo of where we've housed everything, and hopefully you can really find that helpful to use in your practice. So I think that brings us to the end of the demo.
Okay, so now is the time for the questions and answers period. So thank you, Eva and Tanya. We will now move to the Q&A segment of this event. To address some of the audience questions, our speakers for today, Q&A is Catherine Kerr and Laurie Charles. Catherine Kerr is an infection prevention and control specialist with Public Health Ontario and has more than a decade of experience in IPAC. Catherine earned a Master's of Science degree in microbiology and immunology from Western University and has been certified in infection prevention and control since 2012. Prior to joining PHO, Catherine worked as an IPAC professional in both community and large academic hospitals. Catherine was involved in development of online learning modules, as well as some of the additional resources that were developed for the infection prevention and control for environmental cleaning in healthcare toolkit. And then we have Laurie Scholzer, is an infection prevention control with Public Health Ontario. Prior to PHO, Laurie has worked as an occupational health nurse in acute care, a primary care nurse with family health team, and a public health nurse with several public health units in Northern East Ontario and Michigan. Laurie has maintained her certification in infection control and occupational health nurse and begins these areas of expertise to her current role with PHO. So now we will start look at the Q&A questions. So Laurie and Catherine will, to Laurie and Catherine now. Thank you. So I'm going to read the first question here. Are the modules available in other language? We have a lot of staff who speak Spanish, Portuguese. So Catherine will give you an answer for that.
Okay, yeah, thank you, Nawal. So PHO has infection control training materials available in French and English only. They include skills and knowledge that has been developed for healthcare workers in Ontario with the standards and legislations that apply in the province. The materials are free, but unfortunately they are not offered in languages other than English and French. Thank you for the question.
Okay, thank you, Catherine. So the second question is, where are the cards located? So the infographic cards, that is the question. So for Catherine, please, go ahead.
I can actually, I can answer that one, Nawal. So we are updating. I know some people were having a hard time finding some of the resources on our website. So we are, as of this afternoon, going to be reorganizing the environmental cleaning landing page. And Catherine has provided a link in the chat for where to go to find that. And we're going to have 3 sections of resources. One will be the education section that's going to include those FAQs on AROs and our huddle resource. But where you can find the infographics, it's going to be a section on visual aids for cleaning. And that will be the infographics, the 3 cards that we showed. And then we'll have another section for auditing. Thank you.
Okay, so we have a question here. One second, I just want to read the question. The question is, can I ask why you removed the wonderful training video that your old environmental toolkit had? For example, how to clean a washroom or etc. So for Catherine, please.
Thanks, Nawal. Yeah, so there was some misalignment with the updated best practice document, and they also weren't AODA compliant. So we did have to remove them from the website. Thanks.
Okay, so there's also another question here. 1 second, just. Can you demo how to access the learning modules?
Actually, we didn't demo live because you do need to register on the PHO website with the username and password to access the LMS system to be able to have those modules in your name. That's why we did the slides, but they will be located, I believe, in the education section for the online learning modules on the environmental cleaning landing page. So there will be a separate icon you can click on to access all of them. And once you click on the modules, they'll bring you to the LMS section of our website.
Thank you, Lori. The following question. Hi there, the website does not appear the same as the demo you provided. The resources tab are not visible. Thank you. It's for Catherine, please.
Hi, so there may be some discrepancies with the website at the moment because, as Lori just mentioned, it is in the process of being updated to be a little bit more user-friendly. It will be updated this afternoon. So if you have a look after that, if there are any issues, please, of course, reach out, but that should all be resolved this afternoon.
Thank you, Catherine. There's another question here. I was late joining. Did you go over the use of the site? Use this site to our staff to do the 5th modules? Would they sign on themselves or would management sign after them? So that's a question for.
Okay, so for the online learning modules, if staff wanted to complete the first 5 modules, including the orientation to the modules, they would register themselves with the username and password on our PHO website. That will allow them to get a specific certificate of completion in their name once they complete the 5 modules. It doesn't eliminate them from taking the 6th module. That one, although it's designed for people leaders in environmental services, once they complete the 5 modules, they can also get a separate certificate of completion for the 6th. But it would be done individually, yes.
Thank you, Lori. So the following question here, we are starting to see Candida auris in hospitals, wondering if there is any special consideration in terms of cleaning and respect to Candida auris that is different than what is already being recommended in Candida auris document. Catherine, please.
Thank you, Nawal. Thanks for the question. So there isn't any, this is sort of outside of the scope of the project, these resources specifically. There aren't any different recommendations in these documents than what are included in the existing best practice recommendations. There's information in the FAQ about the cleaning considerations for Candida auris. And I just wanted to plug to stay tuned because we do have a couple of resources for Candida auris coming out in the next couple of months. Thank you.
Okay, next question. Sorry, just like for Lori, are the videos available on the site still available for viewing? I find these very helpful for all staff, especially the new staff. Lori, please. Thank you.
The videos have been archived on our website due to them not being AODA compliant and not in keeping with the 2018 PIDAC best practice documents. So we have archived those, although they were great videos. Thank you.
There is a question here. How do we provide feedback for these resources? That's a question for Catherine, please.
Hi, so yeah, if you have any feedback on any of these resources, please just email IPAC at oahpp.ca, which is included in the resources, and we're happy to address those for you as best we can.
And we also have a link on our website to a survey that you can complete once you do review the modules, as well as the resources to provide your input that way.
Okay, so there's also a question here. 1 second, sorry. Is it mandatory we have a contracted service for environmental in our home and they have their own learning module? So that's a question for Lori, please.
I didn't quite get the question. They have their own LMS system, I'm gathering. Are they wondering how to incorporate our modules?
Yes, I think they are asking, is it mandatory to do their PHO modules if they have their own learning modules?
Okay, absolutely. It's in addition to what you're currently doing. It does provide a very short, brief review that's current and up to date, 10 to 15 minutes per module. So it's not mandatory to complete them, but it is based on our PIDAC best practice and has been current as of the 2018 document. Hopefully that answers the question. And you can contact lms@oahpp.ca if you want further information on how you can incorporate the online learning modules into your own LMS system.
Thank you, Lori. So the following question here is, will the website be user-friendly for staff to be able to easily find the modules? That's for Catherine, please.
So we hope so. When the website is updated this afternoon, there will be a web page specific to the online learning modules, and they are in our LMS system. So you will be required to register to My PHO with an email address and then register for each of the different learning modules, but we hope that they are easy to access for everybody who is planning to use them.
Yeah, that's a question here for Lori. Maybe an QR code would be helpful for easy access while in congregate setting. So that's also a question maybe for Lori. Would you please?
We're always happy to bring your feedback back to our design team in terms of what would be most useful for congregate. So you can certainly, we'll forward that on, but you can certainly email LMS@ohpp.ca, or I believe our communications department as well, communications@ohpp.ca.
Thank you, Lori. So the following questions here. Our home has Surge learning modules, education for staff. Will we be able to add them to our system program? It's a question for Catherine, please.
I believe so. Lori, I'm not sure if you're aware. I think you'll need to reach out to LMS, but I do believe if you use Surge Learning, they can be uploaded.
Yeah, I'm not sure.
Okay.
I'm not familiar with Surge, but I know a lot of long-term care facilities use it. I believe there are PDF versions as well that can be made available for your learning.
Yeah, you can reach out to afterwards and we can answer this for you.
Thank you, Catherine. So this question here, will the video be updated in the future with AODA compliance at the best practice? Maybe Lori, would you like to answer?
I don't have any information on whether that will be a future plan for us in terms of making them compliant and using the same videos. I know we knew the videos were quite well utilized, but I don't have any information at this time on whether that will happen or not.
Great. Thank you, Lori. The following question here, do we get education credits for completing the modules? Catherine, please.
I'm not sure which sort of education credits you mean. I'm not sure if internally you're offered education credits. We're not offering education credits for completing them. You will get a certificate of completion for completing the modules, but not credits from Public Health Ontario.
Thank you, Catherine. The following question, do all staff need to register to view videos, or can I register and use my login for all the staff? Lori, please.
Which portion were they looking at viewing? I missed the beginning of that question.
I don't see the question anymore. The
question that's okay. To
so
access the online learning modules, they need to register with the username or password, but the additional resources that we spoke of will be just made publicly available without having to register on that environmental cleaning landing page.
Okay, thank you, Lori. So that's a question here for Catherine. What is the link for environmental learning modules? I think the link was provided in the chat, but if Catherine, the link
I was just going to say I just posted, Yes.
Okay, the following question here. I would like to recommend that PHO revisit, make new videos with updated content and AODA in the near future. It appears many of us on the website use them, and it would be updated videos in the future. So this is just a feedback. So Lori, would you like to take that? Thank you.
I think it's great feedback to get this directly from the users at the front line. There is a cost factor associated with creating videos, and so certainly we can bring that back to our leadership team for consideration. Thank you.
You're very welcome. I think no more questions. We almost answered all the questions, and then I will wrap up the presentation here. So as we all wrap up today's webinar, I would like to thank Eva and Tanya for presenting, and Catherine and Lori for answering the questions. I would like also to thank everyone who joined us today, today's PHO webinar. You can expect to receive a brief and anonymous survey for today's session. Please try to complete it. That helps us improve our programming. A reminder to everyone to save the detail TOHPC. This is the Ontario Public Health Convention. It will be held on March 26th and April 3rd in 2024. And now accepting abstract submission for the program. Check out the tophc.ca for details. Okay. That's it. Thank you so much.